So the topic today is transforming your practice by adding regenerative medicine. All right, so let's get started. So I want to give you two promises with the presentation today. The first one is I promise that by the end of the next half hour, you will understand the landscape of regenerative medicine, the potential that it holds for your practice, and also how we can help you implement a regenerative medicine program. And also, if you stay with us, the second promise is if you stay with us till the end of the webinar, you will get a special offer that will save you a bundle on our R3 partnership program. So the future of regenerative medicine is extremely bright. If you recall, 30 years ago, plastic surgery was 90% operative, and now it's 90% non-operative. And that's because of Botox, fillers, lattice, cool sculpting, all of these things that involve the newer technology that keep you out of the operating room. So with regenerative medicine, we're starting to see the same trend. And for instance, in orthopedics, mostly what's being offered is operative. You have some cortisone and things like that, but a lot of the way that orthopedic surgeons, and I have been a practicing one in the past, make revenue is in the operating room. But as regenerative medicine becomes more and more popular, the trend will continue to make more and more of it out of the operating room. So a lot of people, when they do a webinar, and I've seen so many of them, they spend like 2/3 of the time talking about themselves. I'm just going to give you one slide, all right? So very briefly, I went to medical school at University of Virginia, did my orthopedic surgery training at Brown University. Years ago, I got my MBA from Arizona State. Now I live in Phoenix. I've been here 20 years. I left practice a decade ago to pursue full-time business interests. R3 Stem Cell I founded 5 years ago. Currently, we have over 25 centers of excellence around the country that have performed literally thousands of successful procedures. So this is me. I'm married. I have 4 kids. This is my lovely wife, Debbie, my in-laws. Everybody's taller than me except the young ones. Sam is 16, Carson's 14, and then Ari is 3, and Charlie's 1. And we're done. Okay, moving on. So doctors today are working harder than ever to make pretty much less income. So it's a reason to be very afraid. For practices that are hooked on insurance payments, deductibles keep going up and reimbursement rates keep going down with all the bundling that's going on and the denials. For the best commercial insurances, and you pick wherever you are, it might be 150% of Medicare for Blue Cross where you are or Aetna, competition is fierce because typically those programs have out-of-network benefits. So the patients can decide wherever they want to go, right? It doesn't have to be a referral. So competition is fierce and more practices are incorporating direct-to-consumer marketing. So when you look at it with more work, less income, more competition, it's a pretty stressful combination. And this is not the answer. So I go to practices a lot, and what I hear a lot is, well, I have to see more and more patients just to pay my staff. Well, if you try and turn your practice into this analogy of cattle, it's going to stress you out even more. It's going to stress your staff out. It really is not the best solution, is just to fill the funnel with more and more and more patients. So with the traditional practice, you often rely on physician referrals. And I see this a lot, less so now, but they think of marketing as, taboo. We don't have to market. We just have PCPs who refer us patients. And if they do market, they turn to traditional mediums that are outbound marketing like print, radio, or TV, where literally 95% of those who hear it or see it, they don't care about what you're offering. And they don't really incorporate self-pay ancillary treatment options because they really don't want to have to sell anything. They just want everything to go through insurance. Most physicians that we see are late adopters. They want everybody else to try something first, and then maybe, they'll take it on if insurance starts to pay for it, and that's just not the new normal. So do you double down? A lot of physicians in later years decide to do that. They put their head in the sand, decide, I'm just going to ride this out. until I retire, which is a terrible way to look at it. This can result in practice erosion, a higher cost of patient acquisition, and the reputation goes down as your competitor's reputation goes up. So the old saying goes, if you're not growing, you're dying. Patients don't go away, they go away to somebody else, right? So if your practice adapts and adds prudent ancillary treatment options with modern marketing methods, you will see significant additional income with an amazing ROI. So regenerative medicine benefits both patients and the practice's bottom line. So, the first litmus test is do no harm, and these are very safe treatment methods. The second one is do, benefit to the patients, and more studies are showing how beneficial these treatments are. And, down the line is, well, I want to make sure it's not going to cost me money, it's going to actually bring in revenue, and it does. Do you add regenerative medicine to the practice? Well, first and foremost, it works. We have a lot of studies, and I won't have time to go through them today, but we have a whole compendium of research studies showing just how well it works. And this includes for musculoskeletal, for aesthetic, for systemic conditions, whether it's COPD or kidney failure, pudendal neuralgia with pelvic pain, erectile dysfunction. We have more studies coming out every month that are showing how beneficial it is. And also it's very safe. The amniotic fluid that our providers use, we've had, thousands of procedures, no rejection ever, one infection, which was superficial, and amazing benefit. It's a very low barrier to entry. So you don't, have to buy a cryogenic freezer. You don't have to go out and spend, tens of thousands of dollars on capital outlay. You just don't need to do that. And there are several treatment options, which we'll go through with differing price points. Now, the out-of-pocket, it's an out-of-pocket expense for patients, except for a couple of situations, which we'll talk about. The margins are very high. So on PRP, after your cost of goods sold and paying your staff, platelet-rich plasma therapy has margins anywhere from $350 to $800. Okay, it's not bad for about 20 minutes of your time, and it's usually a series of 3, so multiply that out. The stem cell therapy with amniotic, you're talking about 20 minutes of your time on top of the visit. So we're talking after cost of goods sold and paying your staff, what you're going to be left with is anywhere from $1,000 to $3,000 of margin. Just to give you an analogy, this kills me every time I give this analogy, but when I was in practice, we used to do a lot of hip and knee replacements, and the reimbursement, I was in practice 10 years ago, but over 10 years ago, but these figures have not changed very much. This is 2013. Total hip or total knee is around $1,500, $1,600. Now, CMS proposed that year to drop the knee replacement reimbursement by 34% and the hip by 30%. Thankfully that didn't happen. A lot of societies backlashed, so it didn't change. But these figures really haven't changed very much. They certainly haven't gone up. So you're going to spend a lot of time with the patient. You're going to do the operation for a couple hours. You're going to have 90 days of global, and that's the reimbursement. So for the same amount and a lot of the same benefit, you'll do a 20-minute procedure, get the same margin. Patient's going to feel awesome. No risks, minimal risks. All right, so we're reaching a new normal. All right, regenerative medicine is now replacing the Band-Aid method of medicine, whether it's a cortisone injection into the knee, whether it's a lot of the pain management methods that we see now with radio frequency, which can last a year, but it doesn't change or modify anything. What we're seeing now is that these regenerative treatments are able to help repair tissue. I don't use the words heal or cure, because that's not what's happening. It's just repair and regenerate. You're not going to cure someone's COPD. You're going to help repair and regenerate some of the tissue, but it's not going to heal or cure. So be careful when using those words. Now, I did use the word here. I just kind of bit myself. But the problem with cartilage and tendon and ligament healing, as we all know, is that it never heals back to 100% with damage, right? It goes back to 70, 80%. So you can help heal it back more to what God gave you with these stem cell treatments. All right. It's a very exciting proposition. These treatments can help fill the gap that exists now between non-operative and surgery that we just haven't had. All right, there's three types of practices that I see. One is Walmart. Think of that cattle picture where you just see more and more and more patients to try and make more and more money. Terrible way to practice. Then I see ones on the other end, like MD VIP practices, which are Nordstrom. They see less patients, but they make more money from each patient, and they can give more time to each patient. Now, where a lot of practices want to be is the Target. Target has sort of inserted themselves into the economy where they have a little bit lower volume than Walmart and a higher perceived value. Okay. So what I see is where most people want to be is a combination of these two. So that's what regenerative medicine can help you to become. Regenerative medicine is sweeping the country. A lot of the calls that we get are from physicians who say, you know what, my patients are asking about this. I just started hearing about it. I want to start offering it. So patients are asking about it. More and more research is coming out. So if you don't carve out your niche now, your competition is going to fill the void and start stealing your patients. Now, there are several options of regenerative medicine to add to your practice. So one of them I put, but it's not really that exciting. Nutraceuticals like chondroitin and glucosamine sulfate. And patients can buy those at Walmart. They have not been very exciting. I think they give kind of a bit of a minimal. I think they're better in your pets. I see a lot of ads for pets now. PRP therapy has been great. Platelet-rich plasma therapy. It just involves a simple blood draw from the arm. It goes into a kit. That kit goes into a centrifuge, spins around for about 10, 15 minutes. And then the middle layer called the Buffy coat is injected into the knee, the hip, whatever the problem area is. As PRP therapy has gotten more high profile along with stem cell therapies, prolotherapy and prolozone therapy is becoming more popular. These treatments involve just saline and some ozone. There's really no medication being injected, but they're great in conjunction with these other treatments because they can provide I call the signal. If you put stem cell therapy into a knee, you really want to have some kind of a signal to tell it what to do. And that's what prolotherapy and prolozone can do, is spark up some inflammation, which is what PRP does, which, as we all know, is the first phase of healing. And it can say to the stem cells and the growth factors and the cytokines, okay, here's what you need to do. You need to go down this pathway, and it jumpstarts the process. Viscosupplementation refers to Synvisc or Hyalgan or one of these hyaluronic acid treatments, which essentially is covered by most major medical still. It has had some good research, and it may involve a series of treatments. Synvisc has a treatment now called Synvisc 1, but they've looked at all of these treatments, and they all work, but they all work about the same. So you're not going to find one that's pretty much better than the other. I bring it up because I truly feel that if you're going to have a regenerative medicine practice, from an economic standpoint, you should offer viscosupplementation too. There are going to be plenty of patients who come in and they say, you know what? I'm not paying a dime out of pocket. I want something that's covered by insurance. If you have this, you won't lose that patient. Okay? Here's just a small list of the specialties where regenerative medicine is now applicable. I'm just going to run through these. Pain management, orthopedic, and chiropractic. Granted, in I think the vast majority of states, chiropractors don't have the license to actually do the injection, but they do see the patient population. They are really, really good with people. Interpersonal skills are through the roof. And they do have the relationships to bring in an MD, nurse practitioner, what have you, to do the procedures. So I think out of all the providers we talk to all of these, chiropractors are at the top of the list, and we love them because they do a great job and really care about their patients. So pain doctors, orthopedic, chiro, a lot of PCPs we talk to who are good at injections and want to offer it. Aesthetic type practices, plastics and med spas are offering more and more. Systemic type treatments for cardiac, pulmonary, nephrology for kidney, pelvic pain. Now that these studies are coming out, erectile dysfunction, a nice study just came out last month, wound healing and other foot and ankle elements. And then spine, neurosurgery, orthopedic spine. There are some nice codes for ophthalmology, specifically for chemical burns and things like that. Actually, there are codes for wound healing too, for diabetic ulcers. For instance, you can buy the membrane maybe for $1,500, and the reimbursement I think is around $2,900. And it doesn't just take one treatment; it usually takes a few. So there's two major target markets. Number one is the younger population, and then the second bell curve is going to be the older. Younger is usually the athletes, whether it's amateur or elite. All the professional leagues have been okay with these treatments. None are considered a performance-enhancing drug. And when you look at athletes like Hines Ward, who used to play for the Steelers, in the second week of the playoffs years ago, he had a collateral ligament injury. He had a PRP treatment done and was back for the Super Bowl, performed better than ever. Another one would be Bartolo Colon. If you're a baseball fan, you've heard of him. He was out of baseball about 5 years ago. He went to the Dominican, had a stem cell treatment. He was back in the All-Star game like a year later. So it totally saved his shoulder. So it's really good for avoiding surgery for meniscal tears, labrum, ligament, tendon, degenerative disc disease, and the list goes on and on. It's great for either acute or chronic injuries, whether it's golfer's elbow, tennis elbow, a ligament sprain, muscle strain. These things all can do well. Now, I don't want to give unrealistic expectations. If you have a rotator cuff tendonitis / bursitis, it works great. If you have a small tear, it can work very well. But if you have a full thickness tear that has a decent amount of millimeters between them, it's not going to jump the gap. I just don't want you guys to have unrealistic expectation that, oh, wow, I saw this patient who has a 15 millimeter gap and it's going to fix it. No, it's not that. It's not that miraculous. In the older population, the second bell curve, by and large, it's arthritis for musculoskeletal, and it works great. It's immunomodulator for rheumatoid or psoriatic arthritis. It's really good for degenerative and post-traumatic, and also overuse conditions like we just mentioned, also Achilles and elbow. And for instance, if you have a pes anserine, bursitis, tendonitis, it works great for that, runner's knee. Spinal arthritis, whether it's in the facets or inside the disc, there's a peridiscal treatment that works great. Non-healing wounds, we have some studies. If you look at our video on our YouTube channel, stem cell therapy for wound healing, those results have been amazing that we present versus something like Apligraf. And then it's also being used in conjunction with PRP therapy for hair loss and wrinkles. And like I mentioned, erectile dysfunction and other systemic conditions. So real quick, indications for treatment. The most common ones are on the left, which we just mentioned: arthritis, sports injuries, overuse injuries, cartilage defects, wound healing, specifically diabetic or venous stasis ulcers, also crush injuries. It works great. And then ophthalmology. There's 6 codes for ophthalmology. So most ophthalmologists will use some type of, and this could be anything from dry eye to a chemical burn to other types of issues. And it's also being offered for an expanding set of conditions: RSD, diabetes, COPD, neurologic issues, Parkinson's, Alzheimer's, MS, autism, erectile dysfunction, pelvic pain, incontinence, macular degeneration, and kidney failure. A lot of these on the right are used in conjunction with IV treatments, which include also maybe a Myers cocktail, maybe some glutathione to help open up the blood-brain barrier. All right, so let's start moving into the implementation. I'm sure a lot of you have seen Field of Dreams, where the theory was if you build it, they will come. But there's a lot of things that go into implementation if you do it right, okay? What are you going to offer? What treatments? How are you going to train for that? What's your target market? Do you already have your target market in the office? This is usually a higher ticket item, so you want to make sure that the people who you're offering it to can afford it. What's your marketing plan? Do you have one? Who's going to do the sales? Most physicians, including myself, were not very good at sales. Whenever somebody came in the office talking about a bill or something, I was like, whoa, that's not what I do. I just do the clinical stuff. I bring the office manager in. You could do that, or you could have somebody in the office should have that role of making the sale. Who's going to keep the data? It's great to present data, but who's going to do that? And then who's going to get them in for follow-up? Who's going to, talk to them about telling their friends? There's a lot that goes into implementation. So most people have no idea what regenerative medicine is in the public, and that it's an option to help their condition. So it's just a fact. It's pretty new, even though it's getting more and more penetration into the public. Most people just don't know what it is. I have an advisory board of 6 people, and when I first started really pushing R3, I think 4.5 years ago. But I asked the board 2 years ago, I said, how many of you guys know what, and 3 of them are doctors out of the 6. Only 2 out of the 6 knew what regenerative medicine or stem cell therapy was and that it actually was a possibility. So you'd be surprised how many people don't know that it exists as an option. So, all right, so I see a couple questions here. Stem cell therapy will, just answer one of these real quick. Stem cell therapy will not regenerate a complete meniscus. We do have a study. If you look at our YouTube channel, Stem Cell Therapy for Meniscal Tears, there's some great studies out that show that patients can avoid surgery for a meniscal tear with an amniotic or a stem cell therapy treatment, but it's not going to regrow a meniscus. Okay. All right. So when you look at the treatments, there's those that require a harvest from the patient, and then there's those that don't. Okay. When you do need a harvest, the least invasive one is PRP therapy, called platelet-rich plasma therapy. It involves, like I said, a simple blood draw. There are no stem cells in that treatment, but it is a good chemical signal. It calls in the body's stem cells. PRP has about 7 or 8 growth factors, so it has some, not a humongous amount. You put the blood into a kit, and that kit gets spun around very quickly for about 12 minutes. And then you take the middle layer called the buffy coat, and then that's what gets injected into the problem area, knee, hip, what have you. Most of those kits are around $150. And then if you're selling the treatment for $500, $600 or more, depending on where you are and what the competition charge is, and also what your value add is. We have some that charge like $900, and they're like, yeah, but we'll give you 2 follow-up visits. We'll do prolotherapy with it, yada, yada. And, that resonates with a lot of patients. Then you have adipose. Adipose involves a liposuction procedure. It does have very high cell counts. We're talking millions and millions of stem cells. What's the problem with that? It sounds like a great thing, doesn't it? Over 80% of those cells die within 24 hours. So if you take it out, you put it in the kit, you centrifuge it, you put it into the knee, the hip, whatever. Unfortunately, about 80% of those cells die very quickly. And you're talking about typically an older patient, so a lot of those cells, for some reason, we don't exactly know why, they don't have the differentiation capacity of something like an amniotic stem cell. Now, bone marrow has been around for quite a while. It does involve an iliac crest aspiration. It can be done under anesthesia or just local numbing. It's pretty painful. We'll talk about some statistics in a little bit, but it also uses a kit and a centrifuge. Now, when you're young or when you're first born, 1 in 10,000 of your cells in your bone marrow is a stem cell. When you're 70, it's 1 in 2 million. So you can see can you picture the line in your mind going down, 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 down? So, when you're 40, 50, 60, less and less of those cells. So it doesn't matter how much you spin it, there's only going to be so many stem cells that result. Now, when I was at Brown University, a study came out looking at bone marrow aspiration and when did the most stem cells come out? And it's in the first 2 cc's, you get a lot of stem cells. After that, it's mostly blood. So what they've tried to do to help that number is to put more fenestrations in the TUI needle or whatever you're putting in. But still, most of the stem cells come out in the first 2 cc's, and the rest is, it's mostly blood. So that's also a problem. So for those procedures that don't involve harvesting, the first one is amniotic, and that's what my company offers to clients. Amniotic has a lot of stuff in it. Hyaluronic acid, cytokines, over 70, 75 growth factors. It does have some stem cells in it. We'll talk about that in a moment. The newest product, which we don't offer, I'll tell you why, is umbilical cord blood. It's amniotic and placenta based. It does have more stem cells than just regular amniotic. It's the newest product. Why don't we offer it? Well, here's the problem. Umbilical cord blood has MHC factors in it. What that means is that it can cause a rejection. So about 10% of patients have some sort of a reaction. It's not always severe, but it's really an annoyance and kind of raises your blood level as a provider. So we don't offer it. Amniotic, by the way, comes from consenting donors. after a scheduled C-section. It doesn't involve an amniocentesis. Basically, after a scheduled C-section, baby's fine. Everything else is thrown away. The placenta, the amniotic fluid, but it's got all this awesome stuff in it. So the lab has a contract with the hospital, a contract with the mother. The mother is compensated and consented, and the hospital is compensated and consented. And the fluid sterilely goes to an FDA-regulated lab. It's processed as a biologic according to federal standards, and it's tested for everything. And the last one here is Synvisc. Synvisc is insurance-based, as we discussed. We offer the products to clients because it is insurance-based, and a lot of people, just insist on something insurance-based for better or for worse. So we offer platelet-rich plasma therapy, amniotic stem cell products, and hyaluronic acid. All the products are either FDA approved, cleared, or regulated, and the non-harvested ones come from our lab that is AATB Certified, which stands for American Association of Tissue Banks. That just adds another layer of protection on top of what the FDA requires. There's no embryonic stem cells used. There's no ethical concerns at all. It's minimal manipulation. We'll talk about minimum versus maximum manipulation in a second. We offer on-site, travel, and virtual training options. So how does the FDA view stem cell therapy products? Well, they've broken it down into two categories. The first is minimal manipulation. That's okay in the United States. These are same-setting procedures. There's no culturing to expand cell counts. If the FDA finds out that you are taking bone marrow or adipose or amniotic, putting it in a lab on a petri dish or whatever, and culturing it, you'll get sued. It's against the law in the US. There's no enzymes or additives added that change the biologic structure of the material. What the FDA looks at that is changing the biologic to a drug, and they'll go after you for that. It's happened to various companies over the years, and those companies have either gone out of business or they're in, Panama or Cozumel or Cayman Islands. So maximum manipulation is not okay in the United States. That is turning the biologic, like bone marrow, adipose, into a drug, like I mentioned, and that involves either the culturing or the additives. So when you see ads for that, that's either in, like I said, Mexico, Cayman, Caribbean, Panama. All right, so an overview of amniotic stem cell therapy. I already said some of this, but it's effective, it's safe. Thousands of procedures our providers have done. Never had any rejection, had one superficial infection. It's very easy to administer. It comes on dry ice, or you can have a cryogenic freezer. You thaw it out. It's good for 3 days on the dry ice. You thaw it out in 10 minutes. You can inject it as is. It's very pure. Or you can dilute it up to 3-to-1 with saline or sterile water. We have 25 treatment protocols available to our clients for anything from small joint, large joint, IV infusion, diabetic neuropathy, wound healing. I mean, the list just goes on and on. The FDA regulates these products as a biologic. There's no embryonic cells. It falls under the minimal manipulation. It's consented mothers after a scheduled C-section, and it's kept on cryopreserved until it's used. I just want to go through a few myths because we hear these every day. Some of the competitors have cherry-picked a couple products and tested them and found that they had no live cells in the product. So it's going to vary. If the lab that's producing the product radiates the product, it kills everything except the growth factors. If they add too much of the wrong preservative when they cryopreserve the product, it's going to kill all the stem cells. But it doesn't have to. All right. For instance, there was a study in '95 looking at various cryopreservation techniques with DMSO, which is a cryoprotectant. So what they showed was significant stem cell viability if you use 20% or less DMSO. And you can cryopreserve it at -80 degrees. It doesn't have to be -200 degrees. We've heard that a lot. Oh, the stem cells only can survive if you preserve them at -200 degrees. And that's not true. That study was done in 95. So that's a bunch of hogwash. Now, the other one was the cryopreservation study back in 2007. This looked at 4 different freezing protocols, and it looked at viability, and this was in bone marrow. They froze it, and they thawed it out with 4 different techniques to see how much of the cells were viable. All 4 of those methods showed that there was cell viability. There's different cryopreservation chemicals, time frames, and then with both thawing and with freezing, and all of them had some cell viability. So just because you cryopreserve the product doesn't mean it's going to kill all the cells. Our product has had a third-party assay from Da Vinci, which showed an amazing amount of cell viability. So after the product was thawed out is when they tested it. It had all the cells, 24% of the cells were viable stem cells. And in addition to that, there was about 80 growth factors that resulted in the product. The myth number 3 is that bone marrow is better. Plenty of bone marrow companies, I won't mention names, but say that their product is better than either adipose or amniotic. All these biologics have been shown to work well, but none of them have been shown in any of these studies to be superior. Okay. Here's the same statistics I just mentioned about 1 in 10,000 cells is a stem cell when you're born, 1 in 2 million at age 70. So amniotic is much more consistent with the amount of stem cells it has in it, growth factors, so on and so forth. So it also has additional elements, exosomes, messenger RNA, cytokines. So all things being equal, why not use one that doesn't involve a harvest and takes less time? It involves less kits and IV tubing. So the myth number 4 is that it's not FDA approved, so it's no good. We hear this every day on Facebook and on the phone. The bottom line is that it cannot be FDA approved. Amniotic fluid is regulated by the FDA as a biologic under the Code of Federal Regulation 1271. So it's regulated as a biologic. So it cannot have a label, can't be approved or denied, and it can't get a label. So moving into the marketing for implementation, the mediums that we use are different than the traditional. So radio and TV, the cost per lead is very high. Most 95% of the people who hear your message have no desire or need for your services. Print may work depending on the market. Magazines, no. I'm talking about some of these newspapers that involve retirement communities or whatnot. We have a list of those, and we work on those as well. Digital works excellent. We do a lot of retargeting. We use inbound plus outbound. We have teams for pay-per-click. We have a team for social media. We do a lot of webinars. Like, for instance, I have a patient webinar right after this. We do a ton of press releases. We do a lot of email marketing. So when someone signs up for schedules for a visit, we hit them with emails that give them education, because pre-education is key. If they come in educated, they're not going to spend 2 hours asking you questions after question after question. They're going to get down to the nitty-gritty. We have 12 PowerPoints so far, specifically for seminars that our providers can use. We also offer in-office marketing as well, such as a waiting room video that's 10 minutes. We help produce it. Customized brochures, posters, a stand that's good for seminars and in the office, promoting the treatment. So we have graphic designers on staff. Our providers, we use them for that, but that we can also, for no additional charge, design your newspaper ads or anything that you need. Our graphic designers are available. We're a Google partner. We have Facebook experts. We have a certified medical content writing team that's been with us for years. Like I said, we have about a dozen seminar presentations. There are PowerPoints that can be rebranded to you if you want. You don't have to spend hours putting these things together. Posters, brochures, the email marketing, we do it all. We have an answering service that is domestic, that takes all of our calls and vets them for our clients. The waiting room video is awesome. We actually did a whole photo shoot in Beverly Hills a year and a half ago, and we had some great providers, We had at the surgery center, and we had some really good patients. For instance, Chris Spire, he was a Major League Baseball player for a bunch of years, and now he's like assistant manager of the Washington Nationals. He's in the video. We talked to researchers from Irvine and Stanford and the LA Dodgers team physician, for example. They're in the video. Here's the type of ads that we do, and we change them around a lot because on Facebook, you need to change things a lot. So, for instance, we do different ads depending on the location. This is in Orange County. This is in Kirkland, Washington. We have landing pages and microsites for all of our clients, so we can tell what's working in what market, as opposed to trying to do it, one size fits all. We do websites for each of our clients. So you're not just in a directory, you also get a 10-page website. We use live chat 24/7. We have toll-free numbers that go to our answering service. This is an example of the customized brochures that we do. There's a front and back, nice glossy, very attractive. We would do your logo. We would customize the back to your practice. We can put pictures of you, your staff, whatever you want. But these are great for primary care doctors to refer to you in the exam rooms, the waiting area. It's just another thing that you don't have to do. It's all about conversions. When you get into stem cell therapy and regenerative medicine, it's out of pocket. So you're really talking about, a few steps, getting them to pick up the phone or fill out a contact form, getting them scheduled, getting them to show up for their appointment, and then making the sale. All right. Sales is where the magic happens, and it's where a lot of practices drop the ball. So as part of our partnership program, we've implemented a sales training program that includes scripting that helps make it all about the patient. It's a consultative approach that helps position you and your staff as the experts so that they feel comfortable making that buying decision. And then sales doesn't stop after the procedure. You have decisions that can be made by the patient after the procedure. Do they tell their friends? You can give them something to tell their friend. Do they write a review about your practice? You keep in touch with them month after month with education. You'll be top of mind if they need the procedure again. My knee's feeling great. I'm going to get my shoulder done now that it's bothering me. So we excel in the sales department. We have a lady who will come in virtually or in person and implement your sales training program, provide training for your staff, and then ongoing training so that and then we also have the email marketing so that your prospects are knowledgeable prior to their appointment. I mean, it's an expensive treatment, right? You want the interactions to be first rate and professional, and that's what we help you implement. So data and research is key. We have an IRB protocol that was approved about 6 weeks ago. It's for musculoskeletal treatments. Part 2 is in the works, which will be for systemic treatments. For instance, did you know that in Texas, you can't do an IV stem cell treatment unless it's under an IRB protocol? So we're getting that approved right now. So for our partnership program, each center is added as a co-investigator. So there's no randomization. It's strictly for data acquisition. We don't tell you, okay, you have to perform your procedures like this, okay? You can do them how you see fit, but we accumulate data and a lot of things about the procedures, and it's all blinded so that we can get good data so that we all can use it. Patients love an IRB protocol. It makes them feel protected. It's great for implementing standard operating procedures. And we have an external IRB that approved our protocol and will be monitoring everything. We have a web application that is super easy to use by the patients. They don't have to come in every month or 3 months. We can email them and call them to fill this out. And if they don't do it, the system follows up with another email. And if they don't do it like 3 times, and if with 3 notices, we just call them and say, hey, look, can you please do this? And they really, really like the whole process. The fortune is in the follow-up. Our data shows that over 85% of patients achieve an excellent outcome. It helps people avoid surgery, get back to sports and desired activities. Our follow-up includes phone and emails to acquire data, email marketing program that includes testimonials, and what we call utility. If you hit them with salesy emails, they'll just delete. But if it has great education, that's where you really want them to have a high open rate and engage with you. And the beauty is you don't have to worry about any of that. Right now we have over 40 videos that we've produced. We continually produce more. And that way when we hit them with the videos and the articles, they'll want to see it. And it'll keep you and R3 top of the mind. So when they need treatment or need treatment again, the phone call will come to us. So repeat patients will result, and they will tell their friends. So here's a diagram of all the things that we offer. I've mentioned it. I'm just going to skim right through it. We do a lot of lead generation so that people call, live chat, contact form, and those leads go to one client. All right. And that will be the client who has the exclusive arrangement in that radius. We have webinar and seminar materials that you can use as desired. We offer a client website. We also put you in the directory of R3, the new patient marketing, which I mentioned. We have an answering service, excuse me, that's domestic, that can, in real time, send the leads to you, or we can do scheduling through our scheduling software. We have a waiting room video, as I mentioned, brochures and posters. We have educational materials. For instance, those 40 videos are all in your back-end portal. So you can watch them. You can watch them with patients. There's some that are just meant for providers. We offer closing scripts and ongoing sales training with our dedicated client rep. We have treatment protocols. Right now we have about 25. We're adding to that, but those are all in the back-end portal. So if you're like, I wonder how I should do the diabetic neuropathy treatment, we can verbalize it to you, but it's also in the back-end portal of what's worked for our other clients. We have first-rate products, and then the IRB research study, and then we do a lot of email marketing as well. So when you look at this, I call it life cycle marketing because we really have closed the loop on helping generate patients, helping get them in, convert them, and then follow up with them. Here's a couple examples. This is a collateral we use for our seminars. So when they come in, we offer them, the special offer. If they book their appointment while they're there, and then this gives a lot of information on the musculoskeletal. If you're a cosmetic or a different type of physician, we can just change this for what you're going to be talking about. This is what you get with the DVD. It's a 10-minute news segment for the waiting room. We produced it in association with Dr. Hamoff, who's won bazillions of awards for his documentaries. So why work with us? Well, we're going to implement the whole thing with you. We'll give you an exclusive territory. We unload your front office so we can answer all those educational questions and send emails so patients are pre-educated. You're not going to get slammed with front office calls that want to talk about everything from, does insurance cover it? What's the fee schedule? What's this? We can take a lot of those calls. Our IRB protocols will help with marketing because patients love the idea of an IRB protocol. It'll help with conversions and it'll help protect your practice. We don't tell you what to charge your patients. Other competitors to us, and there's really not many, they want to participate in your end game. Like for instance, if you charge $3,500 for a procedure, they're going to want, say, 20% of that or something. I just think that's ridiculous. And it's also a gray area. There's a certain thing called fee splitting and federal anti-kickback laws. We don't want any part of that. So for instance, when we generate leads for your practice, we don't get paid per patient. That's illegal. We get paid per lead, which has been approved by the OIG as of 2007 as a marketing method. Our fees are very transparent. You'll see in our proposal that it's really transparent what would be a cost. We don't nickel and dime anybody. Our fees are nominal upfront, and the baseline fees and minimums are nominal as well. Some of our competitors want to charge like $25,000 for a territory, minimums each month of like 10, 20, 30 units. They require you to spend X amount on marketing. it's not the way it should be. When I was in practice, that's the way I thought of how to do all this was, what would I want to do if I was back in practice? So that's the way that we do it. So as a special offer for spending some time with me here, for the startup, we'll offer you $250 off your startup fee, and we'll give you a unit for free. All right. One of the beauties of being part of the partnership is not only helping grow and manage, your regenerative practice, but we also offer significant discounts off of our product. But for your first 1cc, we'll give it to you free. And one thing is, for our partners, in the subsequent months, the first unit every month is half off. So that's a benefit. Now, we only have so many exclusive territories. The company's 5 years old, and the partnership program has come to fruition in the last few months because we've been able to close the loop on a lot of the technology that we're offering and the IRB protocol and whatnot. So there's quite a few territories available now, but I don't foresee that being the case, over the next few months. Just let us do the heavy lifting. You can contact us anytime at 844-GET-STEM. There's a lot of information on our website. We have the patient side and the provider side. You can email us too if you want. And then our national sales director is Kathleen. She goes by Frankie. If you want to ask for her, she'd be happy to talk to you. And she's the one also that would do the virtual sales training with you. Okay? All right, so that is the bulk of the presentation. I do have an offer here. Let me switch to that. Okay, so on the right side, you can see that the offer I just mentioned. First unit is free. We'll give you $250 off the startup. And if you wanted to go through the landing page to check it out, you can. Or just, there's no special code, like you have to say, R3, whatever. Just mention you saw it on the webinar and you wanted to take advantage of it. So what I'm going to do is go back to the chat room here. And I wanted to answer any questions that you may have. Okay, not seeing any questions yet. All right, so Ralph asked, how does it repair the meniscus? Well, I'll give you the theory of how it does that. If you look at our video, stem cell therapy for meniscal repair, for meniscus tears, I can't remember the title of it, but basically what happens is when you inject the material, whether it be for diabetic neuropathy or meniscus or the outer part of the disc, peridiscal, a lot of what's happening with the stem cells and growth factors is neovascularization. And that's one of the big problems with diabetic neuropathy, right? Is you lose a lot of the vascularization. So when you get that neovascularization, you can end up getting some repair of, whatever the damage is, whether it's the small nerves, whether it's some area of the meniscus that's torn. But it's not to the extent of like a lizard, where a lizard regrows its tail. You just don't see that, right? So that's what's happening. And then a big part of the treatment is providing the signal. So as an example, if you're treating hallux rigidus in the foot, the big toe, then if you just inject maybe some if you just inject some amniotic, it's going to work, but it's not going to work as well if you, say, did some dry needling of the joint capsule, or if you added some cold laser to it, or, some shockwave treatment, maybe put some PRP in. That's what our treatment protocols talk about. Dr. Werber is a longtime podiatrist. He's the owner of the lab, and he's done hundreds and hundreds of cases of neuropathy and foot and ankle. So, for instance, we have a new practice in South Florida that we're working with, and he's going to go and help implement their wound care program. So that's the type of that's the difference between us and the competitors. Well, there's a lot of them, but a lot of differences. But one of them is, anybody's can come in and say, hey, look, we have a great product for you. Okay, tell me about it. Well, they're either going to talk about quality or price. Well, we know we have great quality and great price, but we have so much more to offer because this is a program that requires a lot of attention, which, frankly, most providers are very busy and don't have that. We do. All right, there was a question about hemophilia. So it will not help hemophilia. The difference, obviously, between the stem cells involved in these types of treatments versus an embryonic stem cell treatment. So while I'm seeing if there's any more questions, I'll tell you about the problem with embryonic stem cells. Years ago, there were some studies in baboons, and they looked at treating baboons with degenerative disc disease with stem cell therapy. They injected embryonic stem cells into the disc, and they found that about 30% of the baboons developed chordoma tumors. So they aborted the study, and we now realize that embryonic stem cells a lot of times replicate, and they don't know when to stop. So that's why we get a lot of questions about, does stem cell therapy cause cancer? And the answer is it can if it uses embryonic stem cells, but we don't. So bone marrow, adipose, and amniotic do not involve embryonic stem cell treatments. It's either a mesenchymal stem cell or an amniotic stem cell is kind of between embryonic and mesenchymal, but it does know when to stop. All right. Was there any other questions that you guys had? I mean, if you don't have a question now, you can ask it later, right? It doesn't really doesn't matter if. All right. Well, I wanted to thank everybody for participating today. It's been a little more than half an hour. I'm sorry about that. If you want to participate in the one for prospective patients, I realize this is meant for providers, but if you wanted to see the types of presentations that we give, it's very easy. I'll let me copy and paste the the patient webinar link to sign up. Just bear with me for 1 second, okay? Right, here we go. Okay, so if you want to participate or watch the webinar for patients, prospective patients, then you can. If you're become a partner in our program, first of all, you'll have access to the whole PowerPoint. But second of all, we can incorporate. So for instance, the webinar we're doing at, let's see, it's almost 4 o'clock now, that we're doing in about an hour, will incorporate about 6 geographies where our partners are. So it's easy to do it in other areas too. All right. So thank you so much for watching. This will be sent to you as for replay if you want to watch it or have a friend watch it. And just call us with any questions or email us. Have a great night, you guys.